And you said your results were negative. So that meant that you had no genetic markers. Is that correct?
That's correct.
So how did those results, those test results, affect your treatment that you received?
So, at first I was kind of excited that I was BRCA negative, thinking, I won't pass this along to my boys to my two sons who could get breast cancer, or to my nieces and all my family members, cousins. But little did I know, the treatment options were, a little bit less. So it helps, I think, the oncologists know what treatment options are best for you if you do have, the genetic testing done. For me, it was a very important thing.
And you said at first you were excited that you were BRCA negative, but then there was an implication you said for your treatment. And what was that implication did you understand what that was?
Well, I know like some of the PARP inhibitors are not for BRCA negative ladies. For me, I like I was telling you earlier, I took Zejula and I reoccurred very quickly. And that one is supposed to be more for BRCA negative, but it obviously didn't work for me. But not to say that it's not going to work for other ladies. But so there was just things like that I had discovered that there was a lot of PARP inhibitors that my oncologist wouldn't give me because of the BRCA negative state.
Right. You said that you received a PARP inhibitor even though you were BRCA negative. What conversation did you have with your oncologist in regards to the PARP inhibitor you utilized in light of your negative BRCA testing?
Yeah, so we talked about a couple different PARP inhibitors, and she picked Zejula because it is known to help people that are BRCA negative. There was I think one other one that was a possibility, but she thought that the Zejula would work better. So I was excited about that. I mean, it is a daily pill, but and it comes with side effects. But I was like, this is great if I could stay on this for X period of time. It seemed a little bit easier than having intravenous chemo, but unfortunately, it didn't work for me.
Now, other than the BRCA testing, do you know of any other biomarker testing that was done that affected your treatment for ovarian cancer?
I know the clinical trial that I'm on now, they did do a biomarker, but it wasn't going to impact whether or not I was going to be eligible for the trial. So that's the only other one that I had done.
When did your oncologist talk to you about genetic testing? Was it initially after your diagnosis, during your first round of treatment for chemotherapy? When did they talk to you about genetic testing?
It was pretty soon after I got diagnosed that we started talking about it, and then they just had to get approval for that strata test, the genetic test, and then it was fast forward from there.